guys, it's Leah B from Prestige Veteran Medical Consulting. I am a U.S. Army veteran, physician assistant, and former compensation and pension examiner. So today I want to come on and do a discussion about something that's a little bit different than we typically do. So typically we discuss items related to the Veterans Benefits Administration, or the VBA, related to VA claims and disabilities and things like that. But today I want to come on and discuss dental care, and that's a Veterans Health Administration benefit. There is, of course, some overlap with the VBA because some disabilities qualify you to get dental benefits. So I wanted to kind of discuss some of the pertinent details about dental benefits, who qualifies, how you can get it, where you can get more information. So I'm a big fan of the VA's website because they have a ton of great help docs, right? Help documents that kind of give details about who gets what entitlements, where you can get more information from. And that's, to me, like straight to the source of how we can get straight from the horse's mouth, so to speak, of what is legit, what is not legit, what is the real deal. Okay. So I'm going to pull up the VA's help document on this, on dental care, so that we can just look at it together. And then you guys can sort of go and look at it on your own time as well. And you should really familiarize yourself with the VHA or the VA's website to go research the things that may be beneficial for you. Okay, so give me 1 second. All right. Okay, so VA dental care. This is on va.gov /healthcare/about /VA/health/benefits /dental care. Okay. So as you can see, it says if you qualify for VA dental care benefits, you may be able to get some or all of your dental care covered, right? So some people get full dental, some people get partial, depending on what the issue is, right? So it depends on a number of factors, like I said, like your military service, your current health, and your living situation. Based on these factors, VA places you into a dental class, a dental classification, and you get the specific benefits assigned to that. So what VA dental care benefits do I qualify for? So it tells you right here, click on the statement below that describes you best to find out the benefit class and the dental benefits you may qualify for. So I have a service-connected dental disability or condition for which I receive compensation. Okay, so TMJ, bruxism. Did you have some kind of injury in service that to your jaw or to your teeth? Maybe you have shrapnel. Maybe you had cancer, oral cancer in service. Whatever your VA disability is, it's already been recognized as a service-connected disability, right? So I have a service-connected dental disability or condition for which I receive compensation or monthly payments. You are class 1. It says you may qualify for any needed dental care. Okay. Now remember, and it probably says this down further, this is VA dental care that they offer, right? So that doesn't mean that you necessarily can just go to any dentist in your community and they're going to pay for it. Now they do have care in the community, which we'll talk about on another video as well, where they have authorized certain dental people, certain dental offices to do care for veterans, but that's like, there's some administrative paperwork that has to be done for that. So we're not going to get in the weeds on that. So if you are a former prisoner of war, you're class 2C, you may qualify for any needed dental care. You have one or more service-connected disabilities rated at 100%. So if you're a 100% disabled veteran, regardless of whether or not you have the actual dental disability, you're just 100% disabled veteran. You're class 4, and you can get any needed dental care. There's an asterisk here. So please note, if you're being paid at the 100% disabling rate based on temporary rating, like let's say you have a knee replacement, you get a temporary rating for that 100% disability, right? And then it's going to go back down. It says for a reason such as long stay in a hospital or rehab care, that does not qualify for you for this benefit. Okay. So if it's temporary. Now we're not talking about a permanent and total versus temporary. We're talking about you have a specific condition that brings you to 100%. And then after a period of time, it gets back reduced. So you're unemployable or unable to work, and you get disability compensation at the 100% disabling rate due to service-connected conditions. So you're 100% because you're individually unemployable, right? You're class 4, any needed dental care. Again, it has this disclaimer about the temporary rating. Okay. I have served on active duty for 90 days or more during the Persian Gulf War era. You're in class 2. You may qualify for one-time dental care if you meet any of the requirements listed below. All of these must be true for you. Okay. You did not receive a dishonorable discharge, and you apply for dental care within 180 days of discharge or release, and your DD 214 doesn't show that you had a complete dental exam and all needed dental treatment before you were discharged. There's another asterisk here about if you got a dental award letter from VBA dated before 1955 stating that your dental conditions aren't compensable, then you are no longer eligible for class 2 outpatient dental treatment. And then it discusses why due to a public law. Okay. You have a service-connected non-compensable dental condition. So a dental condition that you're not getting disability payments for, or a disability that is the result of combat wounds or a service trauma, any dental care to make sure you have and can keep a functioning dentition. Okay. A VA dental care provider has concluded that my dental condition is linked to a service-connected health condition that is making the condition worse. Then you are class 3 and you get dental care to treat the oral condition that a VA dental care provider concludes are directly making your service-connected condition worse. You are active in 38 USC Chapter 31 Veterans Readiness and Employment Program. You're class 4 dental care that a VA dental provider concludes is needed to achieve at least one of the following goals, making you, so they don't, like, if you're in vocational rehab and you're getting like these benefits, they want to make sure that you're able to complete that, right? So they want to make sure that it's possible for you to complete that program, make you reach the goals of the Veterans Readiness and Employment Program, or prevent you from having to stop your employment program. So any care that is going to like enable you to continue that program, help you get back to your employment program faster if you've had to stop, help you get back to your employment program faster if you've had to stop because of an illness or a dental condition, or make it possible for you to get and adjust a job during the period of employment assistance. And then make it possible for you to be fully independent in your daily living. I get VA care, or I'm scheduled for inpatient care for health condition, and I need dental care for a dental issue that's making my health condition harder to treat. You can get treatment for that dental issue that the VA dental care provider finds making your health condition worse. You've signed up to get care through the Homeless Veterans Dental Program, a one-time course of dental care that the VA dental care provider concludes you need to achieve at least one of the following goals: relieve pain, help you get a job, or treat moderate to severe, complicated, and severe gingival dental conditions. You currently get inpatient care in a hospital, nursing home, or other supervised home-like care setting. You're in inpatient status, and you may qualify for dental services that the VA dental care provider working with your primary care provider concludes you need to manage a health condition a doctor is currently treating you for. So that's a whole mouthful, right? That's a whole bunch of different categories. I encourage you guys to come and take a look at this to see what category you may fall into. Then it talks about applying for VA dental care. I know the VAs are pretty good. They usually have a liaison that helps you get enrolled in VA dental care if you qualify. So you should be able to call the VA and the VA dental department, and they should have an enrollment specialist that can help you walk through this as well. Where do I go for VA dental care? There's 200 VA dental clinics, including Alaska and Puerto Rico. There's a little hyperlink that shows you how to find a VA dental clinic. If I can't get VA dental care benefits, can I get help buying dental insurance? Talks about buying dental insurance at a reduced cost through VA dental insurance program and what the qualifications for that are. At least one of these must be true. You are signed up for VA healthcare, and you are signed up for our civilian health and medical program, also called CHAMP VA, right? So that's about it. So I hope this was helpful to some of you guys. Mostly, I don't expect you guys to remember all of this stuff, right? But just remember, there's a place that you can come and get more information if you don't know about it, right? You can also call the VA, and they can put you in touch with a liaison, like we talked about, that can discuss the specifics of your benefits with you. But just know that this is a really great resource for you to come and sort of check out what you may be eligible for this. We're going to do a video on vision benefits as well at some point, and some of the other kind of things. So please drop some comments if you found this helpful. And as always, let me jump off this screen share. As always, thank you so much for watching, and please like and subscribe. Okay, see you guys later.